Hello and welcome. My name is Dr. Vasilina Gadoncheva. I'm a clinical fellow with the Department of Psychiatry at Children's Health Ireland at Crumlin, or formerly known as Our Lady's Children's Hospital. I work alongside Professor McNicholas, a consultant and a professor and child and adolescent psychiatrist. We have prepared a series of talks on mental health issues and 22q deletion syndrome. And we hope that you're finding this presentations helpful. This talk is about depression and symptoms of depression. I am just going to take a moment to start sharing my screen before I continue. Now, depression in young people with 22q deletion syndrome. It is depression is a widely used term, and we attach different meaning to it sometimes. For example, we use the word depressed to describe being sad, frustrated, having no interest, experiencing short-lived sadness, lack of energy or interest from time to time is common and normal. But as life moves on, we get over that moment and we continue with our lives. However, our mood sometimes can drop for a significant period of time. And when we talk about depression or depressive episode in psychiatry, we mean a prolonged period of time, more than 2 weeks of feeling low in mood. And during this period of time, the person's day-to-day life is significantly affected and they experience emotional distress. So how common is depression in society? So prevalence of depression varies among the different age groups. Depression is rarely seen in young children below the age of 10. Among younger adolescents, depression is seen about 5 to 10%, and the rates increase to 10 to 20, depending on the studies we are referencing in older adolescents and young adults. Some people are more biologically vulnerable to develop depression, and being a female increases the risk of getting depressed at some stage in life. Similarly to other illnesses such as diabetes or high blood pressure, depression could run in families, and there is a certain level of genetic predisposition. That doesn't mean that we can pass on depression to our children, but they might inherit the likelihood of developing depression at certain stage. Experiencing traumatic events as a child, for example, bereavement, some form of abuse or neglect, bullying, all these situations can increase the risk of developing a depressive episode at some stage. Having a comorbid physical illness is a risk factor for developing a depressive episode, which is linked not only to the burden of having a physical condition, but also connected to the increased biological vulnerability and the processes going on in the body, such as inflammation, that are linked with certain physical conditions. The risk of depression is higher for people with 22q deletion syndrome, and similarly to the general population, the prevalence rates increase with age, up to 20 to 40%, and more commonly diagnosed in female patients. So therefore, there is a need to screen for depressive symptoms among the 22q population. Depression manifests with psychological and physical symptoms. If someone is depressed, they feel low most of the time. They could still enjoy certain positive experiences, but this is short-lived. If the depression is severe, people may completely lose interest and enjoyment in life. The young person prefers to isolate and stay at home and avoid contact with friends. Often they may find it hard to focus at school or at, at, at work or in kind of other activities. The, the thinking, the thinking pattern changes. People who are depressed have more negative thoughts about themselves and the world around them. They often experience a feeling of guilt, hopelessness. When someone is depressed, they tend to blame themselves for everything and may start experiencing thoughts that life is not worth living. There are times when people have thoughts of hurting themselves and they might engage in self-harming behaviors, like cutting, scratching, hitting themselves. And a lot of the time, this is a way to express frustration and to express the feelings that they find it hard to verbalize. And self-harm becomes the unhelpful way of managing emotional distress. And interestingly enough, sometimes a lot of the time, a young person who engages in self-harm would describe that actually the act of self-harm calms them down and helps them to feel a little bit better in themselves. So a lot of the time it's used, as I said, as an unhelpful way of managing emotion rather than carrying the intention of ending one's life. But having said that, it does not mean that self-harm should be ignored or dismissed in any way. It is a serious event. Rarely in severely depressed individuals, the negative beliefs could become so prominent and intense that the person loses touch with reality and develops psychotic symptoms. This is the so-called psychotic depression, which is thankfully quite rare, but requires really intense hospital treatment. Depression could, as I said earlier, could manifest with physical symptoms. People report low energy level, poor memory. There is often change in the sleeping pattern and appetite, which could either decrease or increase. People might appear fidgety and agitated, or the opposite, they might be slow and apathetic. The figure on the screen illustrates the cycle of depression. As already mentioned, depression affects how people think, feel, and behave. So self-critical and other negative thoughts increase when someone is depressed. These thoughts make the person feel down, numb, or empty, and as a result, they avoid activities, meeting others, and feel even less motivated, and this perpetuates the cycle. If you suspect that your child is struggling with low mood, you can encourage healthy daily routine as a first instance, because physical activity is known to increase the good, the positive hormones in the brain that battle depression. So and keeping in touch with family and friends and feeling part of something also really helps young people when they feel lonely and isolated. Talk to your teenager openly about what you're concerned about and listen carefully to what they have to say. If it might be helpful that if a family member had experienced depression in the past and recovered, the young person might benefit to learn and hear from their experiences and get the encouragement that they can overcome this period of low mood. Some modification, some changes in the young person's environment, both at home and in school, could help just to reduce the the pressure and to make the environment less stimulating and overwhelming for them. There are some very effective psychological therapies for depression, and cognitive behavioral therapy is just one of the many examples. We also call it CBT. So cognitive behavioral therapy, or CBT, is usually delivered in a block of 8 to 12 sessions, and this type of therapy focuses on identifying the unhelpful thinking, self-critical talk. So the therapist encourages the young person to identify the unhelpful thoughts and beliefs and then challenge and reframe them. CBT promotes engagement with meaningful activities, and so that the young person can kind of experience pleasure and want to experience pleasure more often. In order for a young person with 22q deletion syndrome to engage in cognitive behavioral therapy, they may need the support from a family member to help them put the skills into practice, and and in some cases, a more behavioral approach could be needed. When we're battling a mild depressive episode, just following the basic good healthy routine of exercise, being more active, sleeping well, following a good diet, all these first steps could really help the young person get over this episode much quicker, and without help from a professional. CBT is effective in mild to moderate cases of depression, and in certain situations the mood may not shift though, and it could get even worse. So if this happens, please be very quick to get in touch with your GP and ask for a consultation with a specialist, and a referral to a specialist mental health service would be appropriate in this situation, as sometimes some young people may need more specialized medical treatment. This presentation is not going to cover the treatment, the treatment with medication, but if this is of your interest, we'll be more than happy to do a separate talk on medications that are used in psychiatry. In the end, I would like to thank you for listening. I hope that you're finding this series of presentations helpful, and I would like to encourage you to look after yourself in order to be able to look after your family and loved ones. If you take a minute to complete the feedback form through the 22q Ireland website, that would be much appreciated. Thank you very much, and see you soon.